The first thing they told Sela Crane when she walked into Mercy Ridge Medical Center was to stay out of the way. Not in those exact words. Nobody ever says it in those exact words. But when the charge nurse, a broad-shouldered woman named Patrice Dunmore, handed her a badge and looked her up and down like she was assessing damage at an accident scene, the message came through clearly enough. You'll shadow, Doctor. Feldman on rounds until we figure out where to put you, Dunmore said, already turning away. Don't touch anything you're not told to touch. Don't speak unless spoken to. And for God's sake, don't slow us down. Sela clipped her badge to her scrub pocket and said nothing. She was used to that. Being read wrong. Being underestimated before anyone had even seen her work. She'd spent 3 years learning how to fold herself small enough to fit into rooms that didn't want her. And before that, she'd spent 7 years in places where being small could get you killed. The ER at Mercy Ridge was loud in a particular way she recognized. Not chaotic. Controlled loud. The kind of noise that meant people knew their jobs and were doing them fast. She'd heard that sound before, in different rooms, on different continents, under different kinds of pressure. She didn't say that either. Dr. Feldman was a tall man with reading glasses, perpetually pushed up on his forehead, and a way of sighing through his nose that let everyone in a 10-foot radius know he found them mildly disappointing. He glanced at Sela once, and then addressed his comments about each patient to the resident beside him, a sharp young man named Prescott, who laughed too eagerly at everything the doctor said. She's the new float nurse, Prescott told Feldman, in the tone of someone explaining why a stray cat had followed them inside. Right, Feldman said, and moved on without looking at her again. That was day 1. Day 3 was when Dunmore told the charge station that she hoped the new hire was planning to pull her weight soon, loud enough for 2 other nurses to hear, and not bother hiding their smiles. Day 5 was when a nurse named Tillman asked if Sela had actually passed her boards, or if she'd slipped through somewhere. He said it with a grin, like it was a joke, the kind of joke that means exactly what it says. Sela smiled back. She said, I passed. She did not explain where she'd trained. She did not mention the 7 years. She did not bring up the things she had seen or done in places Tillman had likely never thought about. She finished her shift, drove home to the apartment she hadn't fully unpacked yet, sat on the edge of her bed, and stared at the wall for a while. This was the life she'd chosen. Quiet, unremarkable. Exactly what she needed it to be. She had reasons for that. What Sela Crane did not tell anyone at Mercy Ridge. She had enlisted at 19, been selected for accelerated medical training at 21, and spent the better part of her 20s deployed with a special operations unit in circumstances that were still technically classified. She had done things in the field that most ear doctors with 20 years of experience had only read about in case studies. She had kept people alive in conditions that had no business supporting human life. She had come home, eventually. They all did, one way or another. She had gotten her nursing credentials because she wanted something clean. Something with regular hours and walls and a ceiling overhead. She wanted to hand someone a cup of water and watch them drink it without thinking about extraction routes. She wanted ordinary. She wanted to disappear into the rhythm of a place and just do the work without anyone knowing anything about where she'd been. Mercy Ridge was supposed to be that place. She was 3 weeks in when everything changed. It started with the helicopters. Sela heard them before anyone else did. She was pulling a medication cart down the east corridor when the particular thrum registered in her chest. Not one helicopter. Two. Flying close and fast in a pattern she recognized. Military. Not news, not emergency services. The cadence was wrong for those. She stopped the cart. Tillman, passing in the opposite direction, nearly walked into her. "Watch it," he said. "Two birds incoming," Sela said, military. "Probably 8 to 12 minutes out." Tillman stared at her. "We don't have anything on the board. We will." She wasn't entirely sure how she knew. Some things just lived in your body after a while. The ability to hear a rotary pattern and feel it like weather changing. She left the cart and went to the charge desk. Dunmore was reviewing a chart. "I think we're about to get a trauma call," Sela said. "Multiple." Dunmore looked up with the particular expression she reserved for Sela. Not hostility exactly, more like the expression of someone who has already decided a thing is not worth their time. Based on what? Helicopters. Bearing northeast, low altitude, fast approach. That's not medical evac pattern. This isn't an air traffic control tower, Crane. The radio crackled 4 minutes later. Mass casualty inbound. Training exercise gone wrong at a facility 40 miles north. 12 injured, 4 critical. ETAs staggered. First bird was 11 minutes out. Dunmore moved immediately. To her credit, she was very good in crisis. The administrative coldness fell away, and she became precise and focused and efficient. She called the team in, started assigning stations, cleared 2 trauma bays simultaneously. She did not assign Sela to anything. "Where do you need me?" Sela asked. "Observation," Dunmore said, and moved past her. Observation. The word sat in her chest like something swallowed wrong. She went to Trauma Bay 2 and stood near the wall. She watched the team assemble. Prescott was there, along with Dr. Feldman and 2 other attendings she hadn't worked with directly. 3 nurses she recognized. Everyone moving with the electric purpose of people who drilled for this. The first stretcher came through the doors at a controlled run. The man on it was large, easily 230, most of it muscle, and he was conscious, which was actually not a good sign given what Sela could see from where she stood. Penetrating injury to the left lateral chest. The field dressing was soaked through. His color was wrong in a specific way that she recognized before anyone had put a monitor on him. "Tension pneumo," she said quietly to no one. Prescott, nearest to her, glanced over. "We'll assess when he's on the table." They put him on the table. They began assessment. Sela watched Feldman's hands, watched the numbers climbing on the monitor, watched the patient's neck veins distend slightly. There, almost imperceptibly, and watched the trachea begin its subtle shift. "He's deviating," she said, louder this time. "Please step back," a nurse said without looking at her. "His trachea is shifting left. You need to decompress that chest right now, or you have about 90 seconds before his heart stops." Feldman looked at her sharply. "I said step." The monitor alarm went off, not the slow warning alarm, the bad one, the flat one. For exactly 2 seconds, everyone in the room went still, with that particular human instinct to freeze in the face of the unexpected. 2 seconds. Sela was already moving. She did not ask permission. She did not explain herself. She reached across Prescott, had the needle in her hand. The right gauge. She'd found it without looking, hands knowing what they were doing before her brain caught up, and placed it in the second intercostal space, mid-clavicular line, and the sound that came back was exactly the sound it was supposed to make. Air escaping under pressure. A whoosh like something being unlocked, and the man on the table took a breath that shook through his whole body. The monitor found a rhythm. The room was very quiet for a moment. What the hell? Prescott said. Sela stepped back from the table. Her hands were steady. They were always steady. Tension pneumothorax, she said calmly. He'll need a chest tube. His pressure's still low, probably hemorrhaging into that pleural space. I'd start with a large-bore chest tube, 2 large-bore IVs, cough, and type and cross-match for 4 units. Nobody spoke. Feldman was staring at her with an expression she couldn't quite read. "How did you know?" he finally asked. "The signs were there for about 4 minutes, she said. The neck vein distension, the tracheal deviation, the pressure pattern on the monitor. Textbook presentation. Textbook." He said it oddly, like he wasn't sure if she was insulting him. "I can step out if you prefer," Sela said. She would have. She would have stepped out and let them work and gone back to her cart, because that was what she was trying to do here. That was the whole point of being here. But Dunmore, who had come in during the last 60 seconds, put her hand up. "You stay," Dunmore said. Her voice was different, not warm, just different. "We've got 3 more coming in." The next 2 hours were the kind that Sela had not let herself think about in a long time. A second patient came in with a traumatic amputation of 2 fingers and a blast injury pattern she recognized from a specific kind of explosive that civilian personnel were not typically trained to identify. She said nothing about that. She managed the wound, controlled the bleeding, assessed the patient for secondary injuries the way you learned to assess for them when you understood that the visible injury was almost never the only injury. A third patient had a femoral bleed that the team was managing with a tourniquet. Correct choice. Good placement. But the patient was also developing signs of compartment syndrome in the other leg, and Sela caught it while everyone else was focused on the first injury. She told Dr. Feldman. He acted on it without comment this time. The 4th patient was the one that made the room go silent again. He came in conscious, talking, which was how people sometimes came in right before they stopped talking. Blast overpressure injury. She knew it by the way he was holding his breath without knowing he was doing it. By the particular confusion in his eyes that wasn't pain but was something stranger. Something that happened when the pressure wave had been close enough to do things to the brain that didn't show on the surface right away. "What's his GCS?" she asked. 14, Prescott said. "He's oriented. He's going to drop," Sela said. "Blast TBI, probably with a small subdural. Get neurosurgery on the phone now. Not in 10 minutes. "He's talking fine," Prescott said. He was not hostile, exactly. Just certain she was wrong. "He was fine," Sela said. "Watch his pupils in the next 4 minutes." She was slightly off on the timing. It was 6 minutes. But the right pupil blew before anyone had thought to call neurosurgery. And then there was controlled chaos as the team scrambled, and Sela moved to where she was needed and did what needed doing until the neuro team arrived and took over. When that patient was stabilized and moving toward the OR, Sela stepped back and realized her scrubs were dark with blood from the elbow down, and she was very tired. And the room was looking at her. Not Tillman, not Prescott, not even Feldman. Dunmore. "Where did you train?" Dunmore asked. Sela looked at the floor for a moment, then at the charge nurse. "A few different places," she said. It was not a lie. It was just not the whole truth. The inquiry that followed was not hostile, but it was thorough. Sela had, technically, performed a procedure, the needle decompression, without a physician order. In the emergency context with a coding patient, it would be difficult to argue that she had done wrong. But hospitals ran on protocol, and protocol ran on documentation, and there were forms to fill out and conversations to have. And Dunmore sat across from her in a small conference room and asked her questions in a measured voice. "Your file shows 2 years at a VA clinic in El Paso before this position," Dunmore said. "Before that, your employment history has a gap." "I was serving," Sela said. "Serving, military. I'm not at liberty to go into detail about the specific unit or assignments." Dunmore was quiet for a moment. She had the look of a woman recalibrating. "You're not just a field medic," she said. It wasn't quite a question. "I'm a nurse," Sela said. "That's what I am here." She expected the inquiry to result in something bad. A suspension, maybe. A formal reprimand. In hospital systems, doing the right thing without a physician's signature could still land you on the wrong side of a committee. What she did not expect was what happened 4 days later. She was ending her shift, still in scrubs, getting her bag from her locker, when Tillman appeared in the doorway of the locker room with an expression she had never seen on him before, something between surprise and embarrassment and something else she couldn't name. "There are people asking for you," he said. "Patients?" He shook his head. He didn't say anything else. He just sort of gestured. She followed him out. The ER had gone quieter than usual for that hour of the evening. Staff had drifted toward the main corridor. Not crowding, but present. The way people gathered when something was happening that they didn't want to miss. She noticed that before she noticed the people. There were 6 of them. Big. The way people who'd spent years in hard physical training, under worse conditions than any gym, were big. They were not in uniform, but they were not in uniform either. There was a bearing to them, a particular stillness. The way men stood when standing at ease was something they'd had to train themselves to do. One of them had a sling on his right arm. 2 others had the careful movement of people not far enough from injuries to forget them. The one in the center was the patient from 4 days ago. The one whose chest she had decompressed. He was upright, which was itself a thing. He looked at her when she came around the corner, and something crossed his face that was not quite what civilians called gratitude, because it was bigger than that word. He said her last name, just the 2 syllables of it, the way people in military contexts said names. Not first names, last names, because last names were what you learned to trust. "Crane, yeah," she said. He stepped forward and extended his left hand, because his right was the one that had been close to the injury. And she shook it, and he said something quietly that she would not repeat later, because it was not something that needed an audience. And then one of the others stepped forward, not the patient, a different man, older, with the kind of eyes that had seen the specific thing you couldn't unsee. And he said he'd spoken with the hospital administration that morning. "We told them what you did," he said. "I did my job," Sela said. "You did more than your job," he said, "and you know the difference." She did. She had always known the difference. What she hadn't expected was for it to matter here. In this building, in this ordinary life, she was trying to build in the ruins of the other one. She hadn't expected anyone to notice, and then to go to the trouble of showing up and saying so out loud in front of witnesses. She felt something shift in her throat and concentrated on keeping her face still. Old habit. Dunmore was there, so was Feldman. So was Tillman, hanging back near the nurse's station with his arms crossed, and a look on his face that she chose not to study too closely. She didn't need anything from him. She had never needed anything from him. The older man. She would later learn he was a senior NCO, 17 years in, the kind of man whose rank told you exactly how much he had survived. Reached into the inside pocket of his jacket and produced something she recognized. A challenge coin, not ceremonial, the real kind, the kind that meant a specific thing in a specific community, and he placed it on her palm without fanfare and closed her fingers around it. She looked down at it. She looked up at him. "Welcome home," he said, quietly, just to her. She hadn't heard those words since she'd gotten out. She hadn't realized until just that moment how long she'd been waiting for someone to say them. In the weeks that followed, things changed at Mercy Ridge, the way things always changed when people were forced to reassess something. Not overnight, not dramatically, but in the accumulated weight of small adjustments. Feldman started consulting her on cases where he'd have previously not acknowledged she was in the room. Prescott asked her once, carefully, with the particular humility of someone his age who had recently realized there was more he didn't know than he'd thought, if she'd be willing to walk him through her assessment process on the tension pneumo case. She did. Tillman apologized. It took him 3 tries to get through the sentence, and she let him struggle with it, because she thought it was probably good for him. When he finally got there, she accepted it without ceremony and moved on. She wasn't the type to hold things. Holding things was expensive, and she'd learned a long time ago to spend her energy where it did the most good. Dunmore never apologized directly. That was not Dunmore's way. What she did was start including Sela in the daily briefings, in the charge rotations, in the conversations where decisions got made. It was more than an apology would have been. It was recognition, which was the thing that had always mattered more anyway. And Sela kept coming in. She kept doing the work. She kept being the person who noticed things before they became problems, who stayed calm when the room couldn't afford another person losing their calm, who knew exactly how much pressure to apply and where and for how long. She had not come to Mercy Ridge to be known. She had not come there to be celebrated or understood or talked about. She had come there because she needed a place to do work that mattered in a life that felt livable, and somewhere along the way, in the chaos of an ordinary Tuesday evening, she had found both. The challenge coin sat in her locker. Some mornings she touched it before her shift, and some mornings she didn't. Either way, she knew what it meant. She had been tested in places where the cost of failure was absolute. She had come through the other side, carrying things she would carry forever. And she had found, in the long, ordinary aftermath of all of it, that the same hands that had kept people alive in the worst conditions imaginable were still good for the same work, just under better lighting, with better odds in a building with actual walls. That was enough. It was more than enough. She clocked in, pulled on her gloves, and went to work.